Now, if you have pain radiating down both legs, that means that something is pushing on a nerve, whether it's tight muscle or disc pushing on the nerve. We don't really need to know what it is, to be honest with you. This is clinical therapy. This is performing exercises, different movements that will decrease your pain and get whatever's pushing on that nerve better. If you want to know exactly what it is, well, go get an MRI, get a CAT scan, and then do the same thing that I'm talking about, because the pictures show what exactly is causing the pain. I show how exactly to decrease the pain, and whatever the picture is, by performing these exercises, you're going to put the disc back in the proper position or the muscle back at the proper length. So if you really need a picture, go to your doctor, get the MRI, see what it is. If you're just willing to get better and know that what exercises you do will fix the problem, then continue following me. And once you get that picture, come back and follow me too, because it'll be the same thing. So if you have pain going down both legs, we need to centralize that pain in the low back. What you need to do is you need to bend forward, okay, multiple times to see if this triggers the pain. So we're actually needing to induce the symptoms. We need to make the symptoms worse, not too much worse, but worse, to discover if bending forward is the position that causes this peripheralization or spreading of pain. Also, if you're sitting for long periods of time, that means you're slumped forward, and that causes pain. So by knowing this causes pain, or sitting for long periods of time causes pain, then we can then discover that we need to perform exercises that go the opposite direction. Once we know that the flexion or the sitting in a flex forward position causes that pain, we'll perform different exercises. First exercise I'd like you to do is to get onto a table and go onto your elbows and lie on your stomach. When you're on your stomach, you want to prop yourself up on your elbows and then bring yourself back down. Prop yourself up and bring yourself back down, and perform that 10 times. See how your back feels. Notice, is your pain getting worse, peripheralizing, spreading, or is it getting better, centralizing, or going towards the center? If it's getting better, continue. If it's staying the same, continue. If it's getting worse, stop. Next thing I want you to do is lie on your stomach and perform a press-up. Now, a press-up is not a push-up. It's where you put your hands on the table, press yourself up, and keep your hips on the table. You're going to feel this in your arms because you're pushing your upper body up while your lower body is staying still. And perform that 10 times. Notice your pain improving and continue. If you notice it staying the same, continue. You need to perform this more. We need repetition. Remember, we're sitting or for long periods of time, gravity's pulling down on us all day. We need to perform more than 1 or 2 back bends to get it right. I've had patients I've worked with, I've had them perform 100 of these in one session, with rest breaks, of course, but after performing that many, they continue to get better. I'd recommend doing at least 3 sets of 10 to see if it's really getting better. And if it is, continue. If you're feeling better but not totally better, then I want you to perform a standing back bend. What you're going to do is you're going to stand up, get good posture, chest up and out, put your hands behind your back, and then you're going to bend back and back to neutral and back to neutral, and perform this 10 times. If it's getting better, continue. Stays the same, continue. If it gets worse, stop. Now you may notice that the bed exercises or the table exercises make it better, but the standing makes it worse. That's because there's more gravity pulling down on us. There's a little more pressure in our low back, and when we back bend, it's going to just kind of tweak it a bit. So that means stay away from that exercise for now. Just continue your table exercises. If you don't have a table like this, which I'm sure many people don't, do it on your bed, do it on your floor, if you can safely get up from your floor. If you have pain down only one side of your leg, we need to do something similar, but change it just a bit. What's happening is the tight muscle or the disc is pushing on only one side or on one nerve, sending pain down one leg. We're going to perform these exercises very similar, but watch what we do differently. We're going to lie on our stomach, and then at this point, if you have pain going down your right leg, you want to offset your hips and move your legs in the direction of the painful side. Once you're in that position, you prop yourselves up on your elbows and back down. And you come up and back down. And you continue this just like we did in the other exercises. Perform 10 of those. Follow the red light, yellow light, green light concept. Next, move on to the press-ups, where you press yourself up, keep your lower body on the table, and back down. And you perform 10 of those. Again, if it's feeling better, go. Staying the same, continue with caution. If it's feeling worse, stop. Continue those press-ups. Next, we're going to stand up and see how you feel. If it feels all better, then don't go any further. If it's feeling better, but there's still some discomfort, well, then we're going to move on to this exercise. We're going to find a wall, place your forearm on it, perform a side bend, and then bend back. Now, let's focus on if there were pain down the left side. If there's pain down the left side of your leg only, you want to put your right forearm on the wall. You want to put your feet together. You want to lean and then put your left hand on your left hip. Push your left hip inwards to close down the painful/injured section. And then you want to bend back. And then come back to neutral and release the hip. And then perform again. Push the left hip in to the right, lean back, come back to neutral. And continue this 10 times. Follow the red, yellow, green light concept and perform for 3 sets of 10. Doing these stretch exercises that we just did loosens the muscle, brings the disc space back to where it should be. But now we need to strengthen the surrounding muscles, the muscles that surround the spine, to hold you in a better position so this doesn't cause pain again, so the disc doesn't push back out, so the muscles don't tighten up again. We need to strengthen the core to stabilize the whole body. All right, I look forward to seeing you in the next one.